Right.
Perfect. Thank you.
Thank you. So in SEARO, our story for social listening actually started in 2019 when we included it as part of our risk communication strategy at the regional committee meeting that September 2019. But we didn't imagine at that time that only 3 months later we would be going, full swing into implementing it. Initially, we were looking at rumors and misinformation. The reason was that in a number of outbreaks that we had in the region, we saw that rumors and misinformation really shot up. And we found that that was also the case when COVID was first reported in the region in Thailand. It was the first reported case in January 2020 outside China. Well, it wasn't COVID then, it was the new coronavirus. And so we focused initially on rumors because Winston Churchill famously said, a lie gets halfway around the world before truth has a chance to get its pants on. This is what happened during COVID. And I just thought I'd show with you the screen for India. India's great passions are cricket, Bollywood, which is their version of Hollywood, and politics and elections. And the three are eclipsed by the search in Google Trends in the last 1 year by the search for COVID. So there's huge amounts of information there, but it's also a problem of plenty. And as we know, that really affects public health if people can't get their information on time. And it's digital media driving the infodemic. There's some very interesting statistics that I found, which said that 1.3 million users joined social media in 2020, which apparently comes to 15 every second. A lot of people say that in the SEARO region, which is mainly developing countries and internet penetration is low, how significant would digital media be? But if you look at how it's increased in the last few years, from almost non-existent a few years ago, right now in India, for example, it's one of the countries where it's really grown. It's more than 50% internet penetration, and in fact, rural areas are also very, very high. So that gives you an idea of what happens in the future. And also people use social media in the context of their lives. So they find something on social media, they share it word of mouth, it's media, it's all interconnected. So it does make a big difference. So we started in 2 types of digital monitoring. First is the rumor misinformation surveillance and response system in February 2020 in response to the rumors we were getting for the new coronavirus. And a few months later, we started looking at the public interest concerns and questions related to COVID-19. Why rumors? Because it can even kill. These are real examples of the poultry industry plummeting. It lost 13 billion rupees because of rumors that the coronavirus is spread by eating chicken. Chicken is very, very popular here. Then rumors of testing also led to a drop in testing, because there were, rumors that it was actually a scam and health workers were usually getting people into the health centers because claiming they were testing, but actually just profiting from them. Then there's stigma and discrimination when it was said that the virus spread through meat. Vegetarians started attacking meat traders. So huge cost of misinformation. We started, therefore, with working with an AI tool called Meltwater, scanning conversations, and there were 58 million conversations scanned from 15 February 2020 to 15 February 2021 in 11 languages for 10 countries with keywords around COVID-19. But rumors always are nuanced, and so you need that human insight at the end of the day, because rumors could be the truth, it's just not verified right now. So how do you make that judgment? It's a subjective judgment, and therefore it's through after further filtering this huge numbers of conversations, it goes through human analysis. We also have a partnership with fact checkers who share with us various WhatsApp rumors, because our surveillance is through open digital media. And over 3,000 rumors have been logged and classified in our rumor repository and responded to in various ways if they needed responding, for which I'll come to later. We have an algorithm. This is what we've found over time. We've partnered with media measurement, and I believe they're here today. So the black line are the cases in SEARO over time, right up to the latest, where you can see the steep rise. You can see the rumors here, they were not very high to start with. Then as India and Indonesia cases started taking off, the cases here increased as well, increased again, and then there was a slight lull. And then early 2021, late December 2020, it increased again, and even though cases were low, and that is most probably because of vaccines. The introduction of vaccines. And since then, with vaccines and also with the latest rise in cases, we've had a very high number of rumors continuing. So out of all the rumors, 24% of rumors concerned vaccines. 19% was of various other categories, including testing, stigma, and others. We do measure, monitor those that dismiss rumors as well as those that are rumors, but only 9% dismissed a rumor. Most of them amplified the rumor. And what's really concerning is, although 64% of rumors were not trending, well, a significant chunk was trending. So this shows the rumors in different buckets by engagement, which is the yellow bar, and volume, which is the green bar. And as you can see, vaccines are very high in terms of engagement, but also by volume, they form a quarter of all rumors that we detected. And the other big chunk is cures, which is, well, 18% of volume and 17% of engagement. This is what we found by country. As you can see, vaccines have very high number of rumors and cures. Some also do prevention behavior. And the countries, the red one here is India. The blue one is Indonesia, this light blue one, and the green one is Maldives. And those are the ones mainly driving rumors in the Southeast Asia region. So how do we analyze it? We look at them for engagement, for reach, for volume, whether it's trending or not, who is spreading them, is it a famous influencer, but also for the level of harm. And then if it's not serious, the then we just monitor it. If it's serious and has a global impact, I usually share it with my colleagues in headquarters. If it's country specific, we inform countries. And if it's a regional impact, then we look at the region. We then respond through various ways. Now, the second part is looking at public perceptions and concerns, similar process, 11 languages in 10 countries. And we look at volumes, topics, sentiment, also highly engaged questions. And then based on the perceptions, we then respond in various ways. These are some of the communication measures we respond. We developed a campaign against stigma and discrimination based on what we found in social media, on our perceptions monitoring. Some key lessons: that partnerships are essential. You can't do it alone. And it's online and offline is critical to get the whole picture. We also need a better understanding of rumors in encrypted and perceptions through encrypted social media like WhatsApp, which is driving a lot of digital information. We also need to do better about how to manage uncertainty, because uncertainty is what drives rumors. Finally, infodemic management is about people, so trust is the key. Thank you.